So you want to become a health insurance agent. How do you do that? I'm going to walk through what the steps are, how much time each takes, and what each costs. So the first thing you need to do is take a pre-licensing course. And you want to take it in health and life. Now, you might be asking, well, I don't want to be a life insurance agent, I want to be a health insurance agent, why do I need life? Some carriers will only appoint you if you have a health and life license. So just do those two and get them out of the way, and you can work with every carrier. So you're going to do a pre-licensing course in health and life. I recommend AD Banker. This course is going to take you 10 to 20 hours. It's not too hard. It's an online course. There are a bunch of sections. You're going to listen to a lecture, take a quiz at the end of each lecture. At the end of all the lectures, there'll be a final exam, and you can do it all online. Once you're done with the pre-licensing course, you'll have a certificate. Then you'll take an exam at your Department of Insurance. So you'll go to whatever state you're in, say California, go to the California Department of Insurance website, look up where and when licensing exams are. You'll schedule a time on the website. Now, when I was getting a license, you had to go into the actual Department of Insurance that was the office that was nearest to you. Now I hear you can sometimes take this test online, but you're going to take a license exam. And I think I had about an hour and 30 minutes to take it. Afterward, you're going to get fingerprinted. This is very important. You might forget. Most states will require you to get fingerprinted. They're just making sure that your fingerprints don't appear at any crime scenes that have happened in the past. Get fingerprinted at the DOI so that the fingerprinted guy doesn't have to come to your house. I did that once. The fingerprinted guy wouldn't take off his shoes. It was kind of annoying. So this licensing exam takes about 1.5 hours. Okay, so now you have a health insurance license. Congratulations, but you can't quite sell Medicare-related products because you're working with seniors, and carriers want to know that you really know the rules so that you're doing right by seniors. So the first thing you're going to do here is take an exam called AHIP. This is a senior-specific exam. It's going to cover Medicare Advantage, Medicare Supplement, prescription drug plans, and a bunch of minor plans that you've never heard of and you might never encounter in your career. So you're going to take the AHIP. Probably takes 8 hours to take the practice modules, the lectures. And this is a serious test. You have an exam at the end of it, and if you fail it 3 times, if you get less than a 90 3 times, you can't take it again for a year. So practice, and a quick hint here is do pay special attention to the practice problems. They have a habit of showing up on the final exam. Once you have taken the AHIP, I'm just going to go over here, make sure there's more room. You then have to do carrier certifications. We call them carrier certs. What does that mean? So there are a bunch of carriers, United Healthcare, Aetna, Humana. They will each have a certification process that you have to go through before you can sell. Sometimes it's just, let me see your AHIP. Sometimes it's, let me see your AHIP, and here are a few other exams. These tend to be really easy. Once you've done the AHIP, you're over the hill. Once you're done with your carrier certs, you fill out a bunch of paperwork, and you're good to go. So this entire process took, call it 40 hours. You are technically ready to sell. Now, do you actually know what to do? I don't know. Maybe if you're quite, do you actually know how to sell? Like, that's another question, and that's something we can help you with. So we have a course called Bedrock University. It walks you through how we talk to agents, how we get our incredible outcomes of 90% annual retention, 96 NPS. And it also shows you how to use our CRM so that you're not working with 100 tabs and doing a bunch of manual calculations for each client. Next up, we'll talk about Bedrock University.